That means that is going to possibly drive healthcare costs and things of that nature. So we need to be cognizant of it. The other thing is that when we think about mortality, morbidity, and mortality, one of the things that the pandemic has unfortunately done is just when we were getting at a point where life expectancy has started increasing for all groups, it actually knocked the African American population down about 2+ years, and the Hispanic population a little less than 2. And so that means we're backtracking, and part of it is because we're bringing all of these chronic disorders to the table. So some additional health disparities we have to be mindful of are obesity, smoking, still alcoholism. These things have plagued our population for centuries. Infant mortality, that's the space that Dr. Austin worked in. I've talked about dementia, I've talked about cancer. So again, I just want you to really understand why we're honing in on these areas. Now, it doesn't mean we're ignoring HIV, it doesn't mean we're ignoring asthma, or we're ignoring multiple sclerosis for that matter. It's just any issue where health is affecting our population, we really need to catch people's attention. And so when we look at just cancer health disparities, what the numbers are just despairing. Basically, 20% of Hispanic children are more likely to develop things like leukemia. Colorectal cancer is just plaguing the US population and becoming one of the top 5 cancers affecting African Americans. Certainly, it says that 70% more minorities are likely to be diagnosed with cancer. And unfortunately, and I'll talk about it a little later, the pandemic unfortunately contributed to a whole lot more individuals being diagnosed much later in stages. I lost an aunt who was diagnosed in stage 4. And unfortunately, when she was diagnosed, it was around the time they were shutting down all of the ambulatory care centers and things of that nature, so she couldn't get some of the treatment and help that she needed at that point. But unfortunately, being a lifetime smoker, the damage had been done over the course of years, so there really wasn't much we could do. So that's why we're going to be talking about this today, because one of the other things that unfortunately happened is that the number of cancer screening, the number of lung cancer screenings particularly, decreased quite a bit during the pandemic, partially because of access to care issues, but because there was so much attention focusing on the pandemic that individuals were scared they were going to get COVID if they went to the doctor's office. And we'll talk a little bit more about the other mental health side of what that looked like. And then again, the priority to care. We've also had to deal with shortage of health professionals. Many of them unfortunately contracted the disease, but then we also had a lot of layoffs and things that impacted the number of healthcare workers. Other disciplines, or I can speak to pharmacy. Pharmacy took on new roles or expanded existing roles. For example, many of you became aware that we started testing for COVID as well as immunizing. Well, we had already been immunizing for flu and other vaccines, but we added COVID to that, which meant it turned out that many pharmacists were working much longer hours and as staff got sick and different things like that. Unfortunately, it led to some pharmacists actually walking off their jobs. And that happened even in hospitals where health professionals, particularly our first responders or first line are essential workers, between getting sick themselves and the work exposure, it was just the stress and the burnout associated with the COVID. So the COVID issue, we couldn't get, protective equipment at the early part of the pandemic. So all of these things contributed to why the screenings weren't done. So what we are proposing to do, after I've told you that long story, we plan to work with the Zetas, the Deltas, and we hope that the other Divine Nine members will consider joining us in what we're calling a cancer prevention and health awareness campaign. And what we plan to do is utilize social media, email, barbershops, just go to the people where there are our faith-based communities and have focus groups so we can figure out What do we need to do to develop strategies to really enhance the importance of things like cancer prevention and other chronic disease prevention? We plan to increase the awareness of these cancers and disorders. We have wonderful partners. You saw 50 Hoops on the previous slide. They do national work with the MD Andersons of the world and the Duke Research Centers, and they work with Moffitt through us. And then we want to make sure, though, that we empower the community, not just about cancer prevention, but vaccinations for other disorders, not just COVID. We also want to appreciate what the community thinks that they need. And that's why we need you, so that we can get to a broader part of the community. So what have we done so far? Well, Reach Up has monthly community consortium meetings, and we've done a few workshops for them. We also participated in a social media campaign for the National Black Cancer Awareness Week back in June. And then tonight's program is one of many that we've done where we're just talking to people about the appropriateness of this. Moffitt Cancer Center also has one of their tobacco cessation office and lung and thoracic cancer department offers 150 vouchers to individuals in the community a year that could get free lung cancer screenings. They also have a mold patrol where they're evaluating moles, because we do know that when moles and warts are on certain parts of the body, sometimes that's a prediction about certain cancers. So we're working very closely with them. Also, free mammograms and other services that are offered. And so we're also trying to incorporate things like colon cancer screening and other screenings at the community pharmacy level. And then our hope is that we can reach a minimum of 2,023 people in the year of 2023. So hopefully, by show of hands, all of you are in the habit of going to the doctor. So if you are, raise your virtual hand, and then Ms. Moreland, let me know. Let me see how compliant our Divine Nine are. Because if they're not, then this is what you're going to get out of participating in this. One, we're going to be reminding people every month through monthly health awareness campaigns that our students have put together about the things that you need to make sure you're getting screened on based on family history, also based on your age. So we're going to be there to make sure that you know. And what we hope that you would do is share with your membership, share with your faith-based connections, share with your other civic and social connections, and more importantly, your family. Reminding them. So tonight we're deeming you ambassadors of We Care. So you are our well-being ambassadors, or actually our Greek ambassadors. But what we really hope is that you will do this. We're going to have documents like this available electronically. We also hope to have some dry erase versions that can be shared with individuals so that if they don't know, they can be reminded. So if you have within your chapter health and wellness communities, or like the Deltas, we have a physical and mental health committee. Those are the kind of groups that we're hoping can take on this and lead this, and incorporating it first in the chapter and then taking it out to the community. We have also been participating in the 50 Hoops Legend Lecture Series. Dr. Austin, Dr. Sneed, myself, Mr. Green are all 50 Hoops legends. And what that means is that the founders of 50 Hoops, who are invested in definitely cancer prevention, cancer research, and increasing participation in trials, have deemed us legends because we've worked so long with them over the years, and we believe in the same things that they do, that our health is our wealth. And so they've been having virtual programs. I hosted one in July. Dr. Sneed will be hosting one in November. So you all will be getting an invite to that event to hear about the latest and greatest on cancer treatments and opportunities for participation in research or other things related to cancer care. Reach Up also hosted an Affirming Fatherhood Conference. And if you were there, it was on your calendar for next year, but they had wonderful workshops designed for fathers to help them be better fathers for their children, husbands to their wives, etc. So those are the kind of things that we also have had a chance, both the dean and I, to share these kind of messages in that conference, and we're grateful for them today. And actually today, as we speak, I'm in Orlando. Thank God for technology, participating in the Department of Juvenile Justice's Restoring Hope Summit, where they're actually working with individuals that are in corrections or criminal justice across the state and talking about these and other issues as it relates to healthcare. So we're doing a ton of virtual and or hybrid educational events. I've done a few with the Delta Sigma Theta chapter, as well as the Zetas. And so we'll continue to do these as we have been asked. We've been fortunate as well to work with other groups like the NAACP, the Urban League. We've worked with the refugee groups. We've got also a strong number of faith-based contacts that we worked with. And just in September, Dr. Sneed met with had a little focus group meeting with barbers and stylists, talking about, again, our initiatives to increase health awareness, utilizing those. So I know all of us, the majority of us on tonight are of the African-American heritage. So we are either seeing a barber or seeing a stylist if we're getting braids, beautiful braids like Dr. Horace Freeman, or whatever we're doing, somebody is touching our hair. And so we do know how important, and it's not that we're vain, but we do utilize a lot of the talents of barbers and stylists. And so that's another area where you all can help us in terms of getting the word out. And so we're doing an iPad initiative with just a small group as a pilot project, but we hope to expand from that as well. And now those are the things that our students are helping us to reach that community. We also, as I mentioned, are going to have monthly email and social media blasts about the health awareness things. We're looking into incorporating hip hop public health videos, podcasts, and again, we just want you all, as well as other groups that I have listed in the slide, to just really be a part of this. Now, what we are hoping to do, and Mrs. Moreland is helping us organize this as well as Reach Up, is we want to develop a wellness club. And so if you, for example, Ms. Michelle Way, say to your mom or your sisters or someone that you want to include them in the email, our email blast and social media blast, they would then get a free membership to our wellness club. And then that will be the mechanism by which they continue to get information or education about some of the health initiatives that we'll be talking about and other special programming. And so tonight you all get your free membership to the Wellness Club. And so you can look forward to getting more information. Now, we are really going to help support AHEC's initiatives with tobacco cessation. We did notice that during the pandemic, some people that were smokers smoked more. And as I shared with you, me losing my aunt was because of a lifetime of me trying to tell her, Auntie, you need to stop smoking. So what we're doing is a challenge within the College of Pharmacy, asking pharmacy students, first starting with our ambassadors, to try to identify 23 people in 23 to help us meet our 2023 goal. And we're teaching them some aspects of patient assessment so that they can effectively identify individuals who need assistance and can capitalize on the resources that AHEC offers, like the Quit Smoking Now classes or free nicotine gum and lozenges, so that we can really help people get rid of that habit. And we really hope that Divine Nine will consider that. And then we're going to continue partnering with Reach Up so that our pregnant mothers also don't harm their babies, because so many of them do continue to smoke. or have difficulty trying to stop while they're pregnant. And we don't want them to even start back. And then one of the things that we're doing with the Hillsborough County school system is the Quit Don't Start campaign, where we're going out to the schools. And this, well, in November, we'll be doing, I'll be involved in at least 3 schools in the Great American Teach-In, where we're talking to them about, unfortunately, the consequences of smoking, hoping that our middle schoolers don't start, and high schoolers, if they've started, they stop. And so again, just working with them on that. So as I mentioned, again, we know that people who smoke, they're at an increased risk for infection and increased risk for complications, and that the people around them, the family who are exposed to the second or third hand smoke, are also at risk for cancers and stuff. And so when we look worldwide, as I mentioned, there's been an increased risk of complications with COVID in people who smoke. And so we really want to make sure that we definitely work on this, because the progression of diseases like COVID is much more likely to be more ambitious when they smoke, because unfortunately the body's immune system is compromised. It sets off systems related to just our whole immunity processes that can be problematic for individuals. And these are just but a few of the smoking health risks that go along with smoking. Now, we're not just going to be talking about tobacco smoke. We'll be including hookah and vaping and e-cigarettes and all of those mechanisms of smoking, because we do know people use many avenues for getting tobacco. There also are some concerns emerging from medical cannabis that we're going to be addressing as well in some of our webinars. We also are planning to join the American Stroke Associations Together to End Stroke initiative. And we're hoping that our educational efforts will do that, because when you look at the risk factors, what are you noticing? It's the same chronic diseases that set us up at risk for COVID that set us up for stroke. And they also set us up for things like Alzheimer's disease. And oftentimes people who smoke also drink alcohol. And then we end up with these kind of issues: the brain being affected, the heart being affected, the pancreas, the stomach, the liver, the lungs, etc. So we have a lot of work to do as it relates to chronic disease management, screenings, our wellness visits, just ongoing preventive care. And so that's what we're hoping comes out of this. And so, as I mentioned, the Alzheimer's disease and dementia space is one of my clinical fortes. And when you look at the warning signs for Alzheimer's disease, what you'll notice is that individuals who have cardiovascular disease, have a history of stroke, have diabetes, all of those things contribute to Alzheimer's disease, as well as vascular dementia, which is the second most common type of dementia. But we also know that there's a connection between COVID infection as well as in terms of cognitive functioning. And so again, as I showed you the slide earlier, where numbers are increasing, we need to be mindful of that. So I want to end talking a little bit about the aftermath of all of this that we've gone through with the pandemic, between quarantining and dealing with social spacing and masking and concerns about the vaccines. We did see an increase in anxiety, depression. A lot of our mental health services were overrun with calls. We did have an increase in suicide, things like domestic violence, etc. And so our resiliency was really tested during the pandemic. And so one of the things we do know is that what's good for the heart is good for the brain. And so we want to make sure that we are mindful of our mental health needs as we go forward. So some of the things that we hope that you will help us message to the community is the need to just take better care of ourselves. So exercising, getting screenings, etc. But one of the things that I do know, Delta Sigma Theta is serious about our health initiatives and making sure that we do our best to communicate messaging to the community about taking care of ourselves. Certainly mental health, definitely Alzheimer's disease, and just a few others. So I know in advance we're planning to work with the Tampa Alumni Chapter in the month of May for some of the activities that they're going to have going on. And I would just hope that if you could put in the chat some of the things that your chapters might be doing or activities, health-related activity that we help get you an audience to, we'll be glad to help you. And so I'll be certainly sharing my email at the end, but I think it would certainly be appropriate that we help support you, because as you put on workshops and webinars, you want to get bodies there as well. And we're fortunate that because of ReachUp, we built a database of several thousand of individuals across the Tampa Bay community and across the nation. And so we certainly want to expose them to the good work that you all are doing. But certainly, in order for us to all be ambassadors, we've got to take better care of ourselves as well. So proper sleep, eating correctly, getting our screenings, all of these things are things that we need to do. And what we hope is the second reason is that we want to just work together more to really advance our missions individually, as well as serve our community better. So how can we collaborate with you? Well, we kind of told you the things that we want to do, and we want you to share with us what and when you're doing the things that you're doing to also reach and help the community as it relates to health. So one of the things that we really need your help in is next Saturday, well, 2 weeks from now, on November 5th from 10 to 2, we're going to host a vaccine and flu event on campus. Ms. Jackson mentioned it at the start of our talk, and we need ambassadors to help us. We'll have to get information into Florida Shots. We'll have to identify individuals. We need marketing especially. And so in the past, WeCare has hosted vaccination events, and we identified individuals from organizations and churches that served as ambassadors to actually collect the information of people that were age appropriate, because at that time it was early in the pandemic, meaning 2020, when 2021 actually, when the vaccine first came out. And so one of the things we learned is that unfortunately, due to technology and health literacy issues or illiteracy issues, we didn't have a lot of our seniors in minority groups, the minority community, being able to just navigate the Department of Health website. And so we set up, I think we did collectively, correct me if I'm wrong, Dr. Sneed, Dr. Austin, at least 3, if not 5 vaccination events all across Tampa Bay. Some were based at the church, but we did have 1 or 2 also on campus. And so this one is going to be hosted on campus. And what we'd like our ambassadors to do is certainly collect the information, and we have a sign-up sheet that would then allow us to input the information into Florida Shots ahead of time. They can actually set up what would be an equivalent to an appointment time. But if you have nurses or other health professionals in your chapters that can actually help us get shots in the arm, we'd appreciate it. We'll be sharing more details about the eligibility criterion, because there are certain vaccinations that we can give free. And so we'll make sure that those that the COVID vaccine will be free for everyone, but certainly over age 18, when you're getting the flu vaccine, sometimes there's costs associated with it. So fortunately, the Zetas were willing to donate towards supporting our efforts with this. And so we're going to be using the dollars that they're using to help offset some of the costs. But definitely, we really need your help, and hope that you'll consider joining us and serving as an ambassador for this event, a marketer, etc. But even if you just if each of us, the 20 so of us got 5 people or told them about it, that would be 5 more than we had. So we really would like to make sure that this is something meaningful and beneficial. And so if you know anyone who has never gotten vaccinated, this is an opportunity. If you know someone who needs a booster, this is an opportunity. If they need COVID and flu, this is an opportunity. Yes, it's okay to give them both at the same time. So this is where, again, you can show off your skills as an ambassador, and we can actually help get the word out. If you want to know more about We Care, I put information on our screen, and afterwards we're going to make sure that you're able to get copies of these slides for all of you that attended tonight, so that you can access our website information, and or you can contact me directly. If you would like a copy of one of our documents that we're using to promote and support mental health, we actually have that we can share with you. We also have an e-video library that includes workshops that Dr. Sneed, myself, Dr. Austin, and others have put on, particularly over the last 2.5 years, that deal with the pandemic and other topics, some of our other health disparate areas. If you're a researcher and you'd like for us to certainly help you with with recruitment for your particular study, we also have a mechanism to work with you through that. We have a community advisory board that helps us really evaluate what it is the researcher's trying to achieve, and then we work with them on marketing it to appropriate eligible individuals for participation. So there are a lot of ways that you all can help us show the community that we care. So I would like to now stop sharing and see if Dr. Sneed, is he still on? Dr. Sneed, would you like to talk to the group a little bit more? If not, I'll show the video, our We Care video, and then we'll take some questions and get everyone to get comments. And again, I'm hoping that you'll consider serving as an ambassador and helping us with our vaccination event in a few weeks. So Dr. Sneed, I'd like to introduce you to this group.
Yeah, I think just for the time being, I'll leave my camera off to save the bandwidth. But Dr. Hill, from the time I saw you today, I did a COVID talk with Meharry Medical College and Morehouse School of Medicine. Had a board meeting with the Foundation for a Healthy St. Petersburg. Jumped on the road, but when I logged on here, I was probably outside of Lakeland. Just putting gas in the car, and now I'm in Brandon. So it's a busy day. But I think the only thing I would like to add on to what you said for all of us here, there was a piece of health equity news that came out really last week, but it's hitting the news this week. Our Caucasian counterparts, their death rate has actually caught up and surpassed that of Blacks. And there's a big discussion epidemiologically why that may be. And the actual fact of the matter is that as many of us that were probably going to be susceptible to the virus have died off in the early phase, and now there's not as many susceptible people left. So now rates have caught up. I think everything you said tonight was appropriate. I'm thankful for all of you that are participating this evening. We need your help. One more thing I would like to say to motivate all of you. Again, something we talked about earlier today, Dr. Hill, you and I. We need to do everything we can to maintain health in our communities right now. We're at a critical juncture right now following the most serious phase of the pandemic, and we need to be there for our kids. And we need to start telling each other, if you can't do it for yourself, do it for your children. We need not, especially as men, we need not turn over the care of our children to somebody else if we can do things to protect ourselves and our wealth and our health. So, we look forward to working with many of you on the call. I'm not sure, I can't see everybody. If there's some Kappas out there, I want to say yo to you guys, and if there's not, I'm here to represent.
You representing.
Okay, absolutely. But yeah,
Well,
Dr. Hill, I think I'll turn it back over to you, and I think you probably have a few questions for people
yeah,
that want
yeah,
to.
yeah.
Oh, I just saw Dr. Purtle. I just saw. I should have known. You know, he's always stalking this cat. I don't know what it is. He is always stalking this Kappa that's talking to y'all right now. No, that's my great friend representing Alpha Phi Alpha, a very proud Alpha man. So, Dr. Purtle, very thankful for your participation this evening, my good friend.
Yes, yes. I am so pleased to see all of you. It just warms my heart. Dr. Deidre Cobb Roberts is representing the AKAs, looks like, this evening. So we're so glad that you're on board, Dr. Cobb Roberts. So I do want to make kind of acknowledge the comments in the chat. Yes, Mr. Houston, we will be sending the slides to all of you that registered this evening. And if you want to add a different email than what you registered for tonight, you can put it in the chat for us. Pershel, you commented on COVID-19, flu, cancer, and cancer prevention as being, I guess, areas of focus that the Zetas are looking at.
Yes.
Okay. And then Mr. Houston said Alzheimer's and childhood cancer, their brothers participate in the walks and voting, but healthcare is on the ballot for every election. And that's true. That is so true. Okay. So I see some common ground here. So Ms. Robinson says she's been working closely with the Dunbar community in Fort Myers. It's predominantly a Black community that has all but been forgotten after Hurricane Ian. And she said she was there and it was extremely devastating to see, and they're in need of mental health services as well as health screenings. So if there's a way that you can communicate some contacts, we'd be glad to help in directly or indirectly. So again, I will put my email in the chat so that you can reach out to me and we can communicate. I know there's some church groups and different groups that are trying their best to help where possible. Okay. All right, so let's see. Then the other comments, she said, many of the places you visited had extensive mold. People are living in their homes in their field with mold, and it's a lot. Oh my gosh, I know it is. So definitely, please share with us. And Dr. Horch Freeman thought it was a great opportunity to connect. Yes, for her to do that. And definitely, I think there's going to be mental and physical considerations. And when you think about collectively, we've had the pandemic. We've had now having hurricanes, and there were so many people that lost jobs or lost loved ones. And when you look at the data, they say, I forget how many, they made predictions on how, excuse me, how many new grieving individuals there are. And I know Dr. Sneed, one of the conversations we also were having today earlier was about the fact that there's going to be, for many of us, people that are going to be missing from the table at Thanksgiving, at Christmas, New Year's Eve.
Yeah,
and
absolutely.
unfortunately, yeah. Mm-hmm.
Absolutely.
Mm-hmm.
And that's something that, if you recall, we started talking about even last year, back in 2021, just the number of people that are not going to be present at Thanksgiving this year, that will not be present, for the Christmas holidays. And that's why, we make the plea right now. We need to do as much as we can to kind of stop that portion of bleeding in our communities. We need to try and do everything we can to be present. The Fort Myers situation is getting more dire by the day. But I also know that there's relief on the way there, but I'm concerned about whether or not it's going to reach the people of color in those communities. So we're going to have to hold a lot of people accountable, hold their feet to the fire. And I'm having conversations on a national level right now, talking to people about that fact alone.
Yes. So Ms. Robinson, certainly that can be one of the things that we hone in on, getting to the those communities that you're referring to, because, you know, a lot of times when you have natural disasters, it's food, but it's also clothes, it's also money, it's also, you know, so many things that we just don't think about. And we were so fortunate, particularly in the Tampa Bay area, you know, that it bypassed us, but it was at the expense of them. And being in education, we've had several students whose families were affected and things. So I could talk all day and all night about the mental health consequences of what we're going to see. But unfortunately, and I will say too, you know, that just as a people, this continuous traumatic stress, you know, unfortunately just weighs very heavy on us physically. And so it's part of the reason why there's such a high prevalence of high blood pressure and diabetes and all, because, you know, we are just trying to make up for lost time. And so we're not taking care of ourselves, and we have to take care of ourselves. Our health is our wealth. And so one of the other aspects of this that I haven't talked very loud about is that we do need to also have financial literacy in the midst of all of this. And so we are planning all of these things to be a part of what we do for the next year. So if you get an email from We Care, do me a favor. If you're not interested in coming yourself, share it with 5 other people. And we hope not to aggravate you to death. I'll blame it on Miss Moreland and Dr. Austin. But we really want to grow our database for the purposes, again, of strengthening the efforts of all of us. And if we all take a moment and just reflect on the founders of all of our organizations and the time by which they were all formed and what they were dealing with at that time and the purpose that drove them. Some of them, it was right with civil rights and women's rights and all of these things. And such a time as this, we have to put our health on that same level. And we survived those times, and now it's a new time. We're fortunate to have more education than many of our grandparents ever had or dreamed of. You know, we're the benefactors of a lifestyle and opportunities that, you know, our children will look back and think they'll have more opportunities because of the things that we've been able to accomplish. But in order for, like Dr. Sneed said, in order for, you know, Dr. Pirtle to be able to go to his son's graduation and see his grandchildren, right? He's going to have to make sure that he's here. And so that's the messaging that we have to get along to people. So thank you all so much for commenting. Again, if you get an email from me and you're available to come out, get vaccinated yourself, register yourself, and then we ask if there's someone in your organization that can serve as a ambassador, meaning a point of contact, that we can ask that they just collect the names and the other information that we need for Florida Shots for the vaccine event. They're more than welcome to come. And they don't have to be Greek. They don't have to be red, purple, blue, or green. None of that. They just have to be people wanting a vaccination. And we'll take it from there. And again, they'll get that free membership in our well-being club, our wellness club. And so we just, again, hope that you all will help us. We really want to, and we should do this kind of stuff more, where we're working together for a common cause. So with that, did anyone have any questions, comments, suggestions? I know I asked you to raise hands earlier, so I noticed Michelle and Purcell, your hands are still up. Not sure if you had questions or if you just hadn't lowered them down or if you're just stretching. But
I'll go ahead and start. So my question is, for the information that you need us to gather, what exactly do you need us to gather from each individual?
So we'll be sending out an Excel sheet that captures their name, date of birth. We have to have that, and an address and phone number, you know, how to contact them. They'll tell us what time between 10 and 2 works best for them. We'll also want to know if they have any of these comorbid conditions, because and allergies, because with the flu vaccine, some of them may be allergic to eggs or something like that, and that, would be concerning for us to administer the vaccine. So it's really demographic data that Florida Shots requires us to load in their system before we vaccinate them. We won't be sharing any of that information with any other groups except there. We will also, once they get there for the event, at that point, we'll be talking, or have information about the wellness club and all, but we won't use that information for anything else. They'll get invited if they choose to. We'll have information there for them to find out more about our educational programming. But it's just for Florida Shots, and they have select information. So Ms. Moreland will probably be you'll be getting an email from her. If there's an individual in your organization that can serve as the point person, they'll just send it back to her. So very few eyes will see it. Yes.
Thank you.
Oh, I'm sorry. I just didn't want to mispronounce your first name, Jevro. She said Miss Robinson was her mother. I was trying to be respectful. I just didn't know how to say your first name.
No, that wasn't for you. I believe
Oh,
Charles
okay.
said, he said, Mrs. Robinson, my thing is in the chat. And I was like, Mrs. Robinson. No, you're good. You're good. We're good.
Okay. So now where are you based at? Do you live in where do you live?
I teach at USF in the St. Pete campus.
Okay,
So
that's what I thought. That's what I thought. Okay,
Yeah,
great.
yeah.
Okay. Awesome. We're so glad to have USF represented this evening. The Bulls, awesome. But we got some Rattlers in the house as well. I know. Cassandra is a Rattler. And all, but it's really all good. So for those of us that will be at homecoming next week, etc. Miss Sabrina, were you trying to show us something? It looks like it said, oh, okay. Okay. And for those of us that are homecoming next week, they probably aren't going to come to Tampa for the vaccination, but we definitely want them to be a part of our well-being club. So we'll be sending out information to you. And again, if there are any other comments, questions, concerns, feel free to reach out. Ms. Cambridge, it's nice to see you on this evening. It's so nice to see all of you. And if you want to turn your cameras on, feel free. I know you're probably like me trying to do 2 or 3 things. As I mentioned, I'm in Orlando at a conference, Dr. Hirsch Freeman. That's why I couldn't respond to you earlier today. But we get it done. We're getting it done. So again, I just want to thank all of you and certainly ask that you keep us in mind for the vaccination event on the 5th. And also this next year, help us if each of us get 23 people to stop smoking tobacco, or get all of their health screenings, or reduce their blood pressure, or start exercising more. Just imagine what good we'll do. And so as we continue to put forth our organizational health initiatives, just keep us in mind. And if it's anything else we can do to help you, let us know, because We Care does care. And yes, children can get vaccinated. And we, again, will have all the criterion for what we'll do. We can also definitely share the flyers, and the flyers will be adjusted and have QR codes on them. So this one that I just showed you tonight didn't have a QR code, but certainly if you're able to send it around. We do want help with the students on campus. Our student ambassadors are going to do a dorm storm, but yes, Dr. Hirsch Freeman, if you have any ideas on ways that we can get it to other groups, we want certainly Mrs. Jevro, we can get it to the other campuses so they can come over too, for the vaccination event. It's all one as it relates to USF. So certainly we appreciate anything that you all do. And again, you're welcome to get vaccinated also. So Ms. Jackson, anything else you want to say to the group in regards to needs for Zetas or anything?
I would just like to say thank you, everybody, for coming, and thank you, We Care Reach Up, for doing this partnership and being that voice in the community that we need to get people the help that they need as far as healthcare is concerned. And I look forward to seeing everybody next in 2 weeks at the vaccination clinic. And hopefully we can garner up a lot of people to come out and get vaccinated and to come help volunteer as well. So
Yes.
yeah, so thank you so much. And I look forward to seeing you all. And Dr. Hill, I'll turn it back over to you. Thank
Awesome.
you.
With that, again, I want to thank Dr. Austin. Again, Reach Up just allows us to be successful in these kind of things, and we're so grateful for your dedication and loyalty. She had to pull aside beside the road to get us going tonight because she was trying to get home after a long day's work as well. And she's been doing that for us, her and her team, you know, for the last 3 years. So please know that you're so appreciated, because without you, we couldn't do this work. And so again, we welcome all of you to the We Care family, and we're grateful for this opportunity. And thank you for coming. So everybody remain safe, and we hope to see you next Saturday. Take care. And Rattlers, I'll see you at homecoming.